Can you talk a little bit about the physiology, like what is happening? Like, because I feel like one symptom that all eustachian tube patients tend to kind of have in common is the pressure ear, clogged ear stuffiness, ear pressure sensation. And is that, I feel like in the patients that have like a dilatory dysfunction where it really is obstructed. And if we see negative pressure, if we see a type C tympanogram, it makes sense like, oh, there's negative pressure, pulling the eardrum in, and that's causing pressure. But, it doesn't, how do you explain a patulous patient feeling that? Or do we know?
Yeah, I mean, if you ever want to simulate a patulous eustachian tube, you take a stethoscope and hold the diaphragm up to your mouth, right in front of your mouth, and you talk and breathe into it. It's extraordinarily loud, and this is exactly what they hear. I can tell you that because if I exercise vigorously enough, I can get the symptoms. It's really annoying. So that's a remarkable simulation, and you will experience this sort of head in a barrel fullness that they talk about. And actually, if it's really bad, your breathing is pushing air back and forth in the ear and giving them a true variable pressure sensation, which they won't describe unless you specifically ask about it. So eustachian tube fullness really is a pressure phenomenon, or it can be just an auditory sense. They'll describe that. We see people with sensory neural hearing loss, and they tell us their ears are full and blocked. If you could only take that cotton out of their ear, they'd be hearing better. So this aural fullness is a very wide description that patients will use, and it's up to us to sort that out.
Yeah, that's a good point. Those like a sudden sensory loss or a Meniere's patient will have that fullness too. So that's a good point. Maybe it's some of it's the sensation that's related to having that drop in your hearing.
Right. So it's up to us to sort out what's the fullness. Is it truly a pressure issue, or is it something really different? Sensory neural loss. Meniere's can have pressure because of the hearing loss or because of inner ear pressure. Semicircular canal dehiscent patients describe fullness, conductive hearing losses as well. And temporomandibular disorders, the list goes on.